Hello everyone. Today I'll be discussing about other psychotic disorders. So in the other psychotic disorders we have many conditions. The first one is the schizophreniform disorder. Schizophreniform disorder is also a type of schizophrenia, but the symptoms or the features of schizophrenia will last only for few months, that is, usually less than 6 months. It is usually associated with good premorbid functioning. So, yesterday I was saying about epiphrenic type of schizophrenia, where it usually occurs in the patient who are having poor premorbid personality. But here in schizophreniform condition, the person is having good premorbid functioning, but still the person is exhibiting the features of the schizophrenia, and most of the patients resume their normal functioning, and the treatment for it is same as that of schizophrenia, wherein we'll be treating the condition with antipsychotic medications, or will opt for ECT or the psychotherapy. So this is about schizophreniform disorder. The next one is the brief psychotic disorder. So what is this brief psychotic disorder? So as the name says, brief, it only lasts for a shorter period of time. Usually it will last for a period of 1 month. Okay, remission takes place within 1 month period. So one or more positive symptoms of schizophrenia is seen in this brief psychotic disorder. So when I say the positive symptoms of schizophrenia, we have delusions, hallucinations, loss of reality. So all these things will be present in the brief psychotic disorder, and it is happening. What is the reason? What is the cause for this? It is usually due to extreme stress or trauma. When a person is not able to cope up with the stress or any kind of a trauma he experiences in the life and is not able to cope up with that, so a person can end up with a condition called as brief psychotic disorder. So if a person experiences psychosis, which will be lasting for a day, and it will undergo full or complete spontaneous remission within a period of 1 month. So, what are the clinical features here? The persons with the brief psychotic disorder exhibits the symptoms, which includes incoherent speech, delusions, hallucinations, bizarre behavior, and disorientation, and remission happens on its own. Okay, so that is brief psychotic disorder. The third one is the delusional disorder. So as the name says, delusional, so it is the person will exhibit a symptom of a false, unshakable belief. So here the essential feature is one or more non-bizarre delusions which will last for a period of at least 1 month. When I say one or more non-bizarre delusion, it means that the person will have a strong, false, unshakable belief related to any kind of a situation or towards a person. Okay, so that is a non-bizarre delusion. So along with this, along with the strong, false, unshakable belief, there may be hallucinations, but it is not so much prominent. The feature of delusion is more prominent than the hallucination. So what are the subtypes of delusions? So we see here under the delusional disorders, we have the subtypes of the delusions based on the predominant delusional theme. So based on the theme of the delusion, we have the subtypes of the delusion under the delusional disorder. So what is it? So we have the first one, which is erotomania, grandiose type of delusion, jealousy, persecutory delusion, and the somatic delusion. So we'll see each of the subtype in detail. So the first one is the erotomania. So what is erotomania? In this type of delusion, the individual believes that someone with usually with higher status, okay, someone of a higher status is in love with him or her. That's what the client or the patient feels. Okay, he feels that he is some person with a higher status is in is in love with him or her. That is a false unshakable belief. So what the client will do? So he knows that he just has a strong feeling that a famous personality, it can be an actor or an actress or a prime minister or a politician or a famous scientist or whoever it is. So a person with the higher status is in love with him or her. That is a strong feeling, false feeling the person is having. Okay, so what he does, okay, he keeps this delusion as a secret. He will not tell this to anybody else. He keeps it within himself as a secret. But at times what he does is he may follow the person or try to get the contact details, try to meet him, and try to talk to the person whom he feels is in love with him or her. Okay, so that is called as erotomania. The second subtype we have is a grandiose type of the delusion. So what is grandiose type of delusion? Here the client feels that, okay, he is having some kind of supernatural power, is having some great talent or knowledge, or is having some kind of his own worth or some power. Okay, so the person feels that he is having a special relationship with a famous person again, or he may assume the identity of famous deity or god or a goddess, or he may assume the identity of religious leaders. Okay, so that is what the person does here with the grandiose type of the delusion, wherein he will assume the identity of a great personality, like a famous leader or an actor or an actress, or he may feel that he or she is a deity, god or a goddess who is having supernatural power, who is able to control everything. Okay, so that's what a person with grandiose delusion feels. The next type is the jealousy type. Okay, jealous type of delusion is otherwise called as delusion of infidelity. So here the person's idea or the theme, okay, the delusional theme is the person feels that his or her sexual partner is not faithful to him or her. Okay, they feel that the sexual partner is having an extramarital relationship. So the individual or the client will start to search for the proof, just to prove to his or her partner that they are in relationship with the other person. They try to get the proof to justify it. And also they may confront the person physically, they may attack the person, okay, that means their spouse, or he may also attack the imagined lover of the sexual partner. Okay, so physically he may try to attack the spouse as well as the imagined lover. Okay, so that is called as the delusion of jealousy or delusion of infidelity. Okay, so the next type, fourth subtype of the delusional disorder is a persecutory type of the delusions. So here the individual feels that he is malevolently treated by the other people. Malevolently treated in a sense, the client feels that he is treated in a very rude, in a harsh way. Okay, so in a rude and harsh way, other people just behave towards him in a very harsh and very rude way, so that it will harm him. Okay, so he feels always, he has a constant belief that he's being conspired, or he's been spied upon, or followed by someone, or he feels that he's going to be poisoned, or he is going to be stabbed or murdered by some other person. So it is the most common type of the delusions among all the subtypes. The persecutory type of the delusion is the most common type of the delusions. Okay, so the last subtype of the delusion is a somatic type. So as the name says, somatic type, here the patient has a strong belief that he is having some kind of a physical deformity or a disorder, or a strong, a very serious illness, or some kind of serious disease. So that's her strong false belief related to the physical or related to the body. Okay, so individuals with somatic delusions believe that they have some physical defect, disorder, or the disease. The most common types of the somatic delusions are nothing but the person believes that he is emitting some kind of odor, okay, some odor from foul odor from his skin, or mouth, rectum, or vagina, and he feels that he is having an infestation of insects in or on the skin. He also feels that there are some internal parasites in him, and feels that he is having a misshapen body or ugly body parts with a dysfunctional body parts. Okay, so that's what is a somatic type of the delusion. So this is about the delusional disorder. Okay, it is otherwise called as folly a deux. The essential feature of the disorder is a delusional system which develops in the second person as a result of close relationship with another person who has already a psychotic disorder with prominent delusion. So here just remember, we have two people. Okay, so we have two people. One person is the actual person, or we call him as a dominant person. Okay, we call him as a dominant person who is actually having a psychotic condition or a psychotic disorder. So there is a second person who is called as a passive person. Okay, so the first person who is actually having a psychotic disorder is called as a dominant person, and we also have a second person who is called as a passive person. So they share the delusion. How the person will share the delusion? The second person actually gets the delusion from the first person. So here the first or the dominant person is sharing his delusion with the second or the passive person. So who are those people? So these two people are the candidates who are emotionally knit, or they are having a very close relationship for years together. They are very close. They have emotional close or emotional bonding. So such kind of people will have this shared delusional disorder. For example, okay, say for example, my friend and me, okay, we are very close. So we are very close. There is a saying that show me your friend and I will tell you who you are. That means, okay, when I am very close to my friend, I share certain common features, or I share certain common ideas. Okay, so when someone sees my friend, they can also assume or find out what are my characteristics. Similarly, when there is a very close emotional bond, okay, with a delusion or a person with a delusional disorder, the second person will get or will get the delusional features from the dominant person. Okay, so the person with the primary delusional disorder is usually a dominant person in the relationship, and the delusional thinking is gradually imposed on the more passive partner. So how is this treatment? What is the treatment for this condition? So the actual person who is having the delusional disorder or dominant person, we call, he has to be treated with the antipsychotics, he has to be treated with the psychiatric medication. Whereas the passive person, okay, is should just be separated. So when a person, the passive person gets separated from the dominant person, so he will get away from, we are separating the person, so they are getting away from each other. Then the passive person gets treated, gets remission on its own. Okay, so no treatment with the psychiatric medication is needed for a passive person, whereas the dominant person with the psychotic condition requires the psychiatric treatment or the medications. Okay, so that is shared psychotic disorder, otherwise called as folie deux. So the next psychotic disorder is the schizoaffective disorder. So what do you mean by schizoaffective disorder? So as the name says, there is both the condition or the features of schizophrenia as well as the affective disorder. So when I say affective disorder, it is the disorders which is related to mood. Okay, so we have nothing but mania and depression. So both the combination of schizophrenia as well as either mania or depression, or both mania and depression, is called as schizoaffective disorder. So this disorder is manifested by schizophrenic behavior with a strong element of associated mood disorders, that is depression or mania. The client, okay, if for example the person is, as I told you, there are three types of the schizoaffective disorder. The first one is schizoaffective depressive type, second is schizoaffective manic type, and the third one is schizoaffective mixed type. Okay, so these are the three types of schizoaffective disorder. Say for example, if a person is having schizoaffective depressive type of the disorder, then he will exhibit the symptoms of schizophrenia. Okay, along with that, he will have the symptoms of the depression. So it can be retarded psychomotor activities or retarded thinking, suicidal ideas. Okay, so those are the symptoms of depression along with the schizophrenic symptoms, that is schizoaffective depressive type. So when I say schizoaffective manic type, so there will be the symptoms of schizophrenia and mania. So manic symptoms, like we have euphoria, the hyperactive behavior or overactivity we call, and self-important ideas, as well as the grandiosity. So along with that, you will have the schizophrenic symptoms. So when I say the third one, which is schizoaffective mixed type, okay, so features of schizophrenia, features of depression, as well as features of mania, everything will be together. Okay, so three disorders in one person at the same time, we call it as schizoaffective mixed type of the disorder. Okay, so this is the schizoaffective disorder. So next one is a schizotypal disorder. So in sixth one, we have the schizotypal disorder. So it is a less severe form of schizophrenia, and the characteristic features are eccentric behavior, and there will be a disturbance in his thinking and affect. So thought disturbances, affective or the mood disturbances the person will have, but he will not have any kind of psychotic features. So psychotic features, when I say, he may not have delusions, he may not have these prominent features of delusions or hallucinations, but he will have the disturbance in his thought and in his affect or the mood. It's a less severe form of schizophrenia, which is a schizotypal disorder. Next, the seventh one, we have the Capgras syndrome. Capgras syndrome is otherwise called as the delusion of doubles. So what do you mean by delusion of doubles? Okay, it is when I look at another person, okay, I understand that the other person is having his own self. Okay, I am different, the other person is different. The identification, I identify another person as another person. Okay, but here in this Capgras syndrome, which is called as delusion of doubles, okay, if I am the person with Capgras syndrome, when someone comes to me, okay, when someone is there in front of me, I just feel that the other person is not a separate individual, but I feel the other person is a part of me. Okay, the other person is also me. That's what is called as delusion of doubles. Okay, it is characterized by delusional conviction that the other person in the environment is not their own real self, but is the person's own or the client's own doubles. Okay, so that is called as Capgras syndrome, which is also called as delusional misidentification syndrome. Delusional misidentification syndrome. Next, we have the eighth one, very, very important, which is the postpartum psychosis. So, what do you mean by postpartum psychosis, otherwise called as puerperal psychosis? So, postpartum is a period after the delivery. So, after delivery, there are a lot of changes which happens in the body of the mother. Yes, there are physical changes, there are changes in the hormones which happens in the mother, there is extra responsibility, the environment changes, there is a total transition from being a woman to entering a new responsibility of a motherhood, wherein there are changes in the physical, okay, in the physical or body, there are changes in the hormones, physiological changes which has happened. Okay, so the mother will undergo some kind of behavioral changes. So that is what is called as postpartum psychosis or the puerperal psychosis. So it is a rare condition. It usually happens in 1 to 2 mothers per 1,000 deliveries. Among 1,000 mothers, only 1 to 2 people or 2 mothers can be affected with this condition, and it's more common in the primiparous women than the multiparous women. So what is primiparous and multiparous? Yes, so primiparous is a lady or a woman who has delivered for the first time. Okay, so who has delivered for the first time. Multiparous is a woman who has delivered more than one time. Okay, so why it happens in the primiparous women? Okay, so first time mothers, they may be very much anxious. Okay, they may not know what is happening to them. Okay, what are the changes which is happening, what are the new responsibilities which they have to carry on, how do they take care of the baby, what are the changes which happens in the environment, role changes happens. So all these things, okay, can cause a stress to the women. Along with that, there are physiological changes which is happening in the mother, can cause anxiety, can cause disturbance in the mood, and can result in the psychosis if not taken care of. Yes, so that is why it usually is common in the primiparous women than the multiparous women. So many of these patients, okay, never experience another psychotic illness until and unless they become pregnant again. So usually these symptoms, what are those symptoms I'll be telling? Okay, the symptoms will appear in the person, in the mother, abruptly within the third postnatal period, within the third day of delivery, and it will be lasting for several weeks after the delivery. And usually the hospitalization is needed because the mother will exhibit certain dangerous symptoms. I'll be telling you what are the symptoms. Okay, so so that's what I was saying. What are those symptoms that the mother will exhibit? Okay, mother will have symptoms of insomnia, anxiety. Okay, she will have lability in the mood. So there will be changes in the mood. Okay, tearfulness, sudden tearfulness without any reasons. She will just burst into tears and inappropriate laughter, okay, without any reason. Okay, she starts giggling or laughing to herself, and there will be restlessness, excitement, okay, sudden withdrawal. She will not interact with the family members, she'll stop talking, and she'll not be caring to the she'll not be caring the baby. Okay, so suddenly there will be a withdrawal to usual activities or the roles and responsibilities. Suspiciousness, okay, and fear. The phobia and suspiciousness, it can be towards the child or towards the husband, towards the relatives in the family. And also the most dangerous feature is the suicidal or infanticidal threats. Okay, she may just have a suicidal ideation, she may go and try to attempt for a suicide, or she may have infanticidal threats. She may have, she may try to harm the baby, beat the baby, or try to kill the baby, or she will verbally communicate that she doesn't want to care for the baby, or she just says, take this baby away from me, or if the baby cries, I'm going to kill him, I'm fed up of this baby, or something like, threats that she may, infanticidal threats that she may communicate. Okay, so this is a dangerous symptom. That is why hospitalization is necessary. Okay, so once the mother feels better, but she will have the feeling of guilt. Okay, guilt, depression, anxiety, all these symptoms the mother will exhibit. So the management, usually the mother will be taken to admitted in the hospital, and she'll be given the treatment. Especially we opt the treatment with the ECT for this postnatal psychosis, since the antipsychotics will be passed through the breast milk. If the mother is feeding the baby, it may have an effect on the child, or on the infant. So we may avoid, okay, this medical therapy. Usually we go for the ECT and the psychotherapy. Okay, so this is about the postpartum psychosis. So it will last for a few weeks, and then with the treatment the mother can be treated. But after that the mother may become normal. She will be normal till she conceives for the second time. Okay, so this is the postpartum psychosis. So next one we have the ninth one, psychotic disorder due to general medical conditions. So there are some medical conditions which can predispose an individual to psychiatric illnesses or psychotic conditions. So what are those medical conditions which will predispose a person to psychiatric problem or the psychotic disorder? So we have these neurological conditions like neoplasms, cerebrovascular disease, Huntington's disease, epilepsy, auditory nerve injury, deafness, migraine headache, and CNS infection. So other conditions we have major, or if you see many of the psychiatric conditions, the etiology will be endocrine related changes. So endocrine related changes, it can be hyperthyroidism, hypothyroidism, hyperparathyroidism, hypoparathyroidism, hypoadrenocortism. Okay, so all these conditions wherein there will be changes in the hormones, endocrine system, changes in the endocrine system, which can cause a person a mental illness. Okay, so next we have the metabolic conditions like hypoxia, hypercarbia, hypoglycemia, autoimmune disorders, systemic lupus erythematosus, other fluid and electrolyte imbalances, hepatic and renal diseases. So these are the medical conditions which can predispose a person to psychiatric or psychotic disorders. The next one is the substance-induced psychotic disorder. Okay, the 10th one is the substance-induced psychotic disorder. So what do you mean by substance-induced psychotic disorder? Substances. Okay, we have substances of abuse. So it can be drugs, or it can be medications, or it can be any kind of toxins. So all these, when they are abused, okay, it gets induced in our body. Because of this, a person will end up with a psychotic condition. So essential feature of this disorder are presence of prominent hallucinations and delusions which are present in the person due to physiological effects of the substances such as drugs of abuse, medications or toxic exposure. So what are those substances which can cause the psychotic disorder? So we have drugs of abuse like alcohol, amphetamines and related substances, cannabis, cocaine, hallucinogens and inhalants, opioid, phencyclidine and related substance, sedatives, hypnotics, anxiolytic medications, anesthetic and analgesic agents. We have anticholinergic agents, anticonvulsants, antidepressant medications, antihistamines, antihypertensive agents, cardiovascular medications, antimicrobial medications, anti-Parkinsonian drugs, chemotherapeutic agents, corticosteroids, disulfiram, gastrointestinal medications, muscle relaxants, non-steroidal anti-inflammatory agents, toxins, anticholinesterase organophosphate, insecticides like nerve gases, carbon monoxide, carbon dioxide, volatile substances like fuel or paint. So all these are the substances of abuse which can induce the psychotic condition in the person. So you understand how important it is not to get addicted to these substances, not only the substances of abuse but also the medications. Okay, so when you come across patients who are on these kind of medications, there are many people who just take over the counter medications. So they just take gastritis, if they have gastritis they may just take antacids or painkillers, analgesics if they have pain. So they get addicted to such an extent that without that they cannot survive. So constant or persistent use of these medications can also cause psychotic conditions. Okay, so this is about other psychotic disorder, wherein I have discussed about almost 10 conditions. So I have told you about the schizophreniform disorders, brief psychotic disorders I have told. Then I've told about delusional disorders, wherein you have different subtypes of delusional disorders, shared delusional disorders, Capgras syndrome, then substance-induced delusional disorders. Then I have told you about general medical conditions which can predispose a person to psychosis, postpartum psychosis, as well as schizoaffective disorders. Okay, so this is about the other psychotic disorders apart from the major one, which is schizophrenia. Hope you all have understood. Thank you.